Okay, this is first aid 2021 and page number 727, rapid review section 3 and key association. So there is a short topic in this page number 727. So after this I will be immediately continuing page number 728 also in the same video so that it will be easier for revision. So let's start from the beginning. On the left hand side there is a disease or finding, and on the right hand side there is most common or important association. So let's not delay and start the first line. A mitochondrial inheritance. There is a association with disease occurs in both male and females, inherited through females only. So in mitochondrial disease or inheritance, disease can be present in both male and females, but inherited through females only, but not with male. Okay. In intellectual disability, there is Down syndrome, Fragile X syndrome, vitamin deficiency, which is it is for USA. Okay, so folate. Okay, so pregnant women are at higher risk. Body stores only 3 to 4 months supply. Prevent neural tube defect. Lysosomal storage disease. This is Gaucher disease. Bacterial meningitis more than 6 months as pneumonia. Bacterial meningitis in newborns and kids. It is group B streptococcus, E. coli, Listeria monocytogenes in newborns. Okay. So the page number 728. The same continuation for disease findings and most common important association. So here HLA-DR3. HLA-DR3 can be associated with many conditions like diabetes mellitus, type 1, SLE, Graves' disease, Hashimoto thyroiditis. It is also associated with HLA-DR5 Addison disease. So diabetes, SLE, Graves, diabetes, Graves, SLE, Hashimoto, Addison disease. HLA-DR4, it is for diabetes type 1 mellitus, diabetes mellitus type 1, RA rheumatoid arthritis, and Addison disease. Bacteria associated with gastritis, peptic ulcer disease, and gastric malignancy. Adenocarcinoma, maltoma. Bacteria associated with gastritis, peptic ulcer disease, and gastric malignancy. Adenocarcinoma, maltoma. It is H. pylori. Opportunistic respiratory infections in AIDS. There is pneumocystis jirovecii pneumonia. Pneumocystis cystis jirovecii pneumonia. Opportunistic respiratory infections in AIDS. Helminth infection in US. Enterobius vermicularis. Helminth infection in US. It is Enterobius vermicularis. Opportunistic respiratory infection in AIDS. Pneumocystis jirovecii pneumonia. Bacteria associated with gastritis, peptic ulcer, and gastric malignancy, adenocarcinoma, maltoma, H. pylori. Viral encephalitis affecting temporal lobe. Viral encephalitis affecting temporal lobe, that is herpes simplex virus 1, HSV1. Infections secondary to blood transfusion, that is hepatitis C. Infection secondary to blood transfusion, that is hepatitis C. Viral encephalitis affecting temporal lobe, that is herpes simplex virus 1. Food poisoning exotoxins mediated. Food poisoning exotoxin mediated. Food poisoning exotoxin mediated. Food poisoning exotoxin mediated. S. aureus and B. cereus. Bacillus cereus. Osteomyelitis S. aureus, most common overall. Osteomyelitis is sickle cell disease, salmonella. Osteomyelitis with IV drugs abuse or IV drug users, S. aureus, Pseudomonas candida. Aureus pseudomonas candida. UTI E. coli, Staph saprophyticus, that is in young lady. STI, sexually transmitted infection or disease. It is by Chlamydia trachomatis, usually co-infection with Neisseria gonorrhoeae. Nosocomial pneumonia. It is S. aureus pseudomonas klebsiella, uh, Acinetobacter, 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 aureus pseudomonas Acinetobacter. Pelvic inflammatory disease, Chlamydia trachomatis, Neisseria gonorrhoeae. Metastasis to bone, prostate, breast, kidney, thyroid, lungs. Prostate and breast is more common than kidney, thyroid, lungs. Metastasis to bone. Metastasis to brain, lungs, breast, melanoma, colon, kidney. So bone mets is more common in prostate, breast, than kidney, uh, thyroid, lung. Mets to brain is more common in lungs, breast, and melanoma, colon, kidney. So mets to liver is more common in colon, then stomach, then pancreas. S3 heart sound can be heard when there is increased ventricular filling pressure, MR and AF, common in dilated ventricles. S4 heart sound in stiff hypertrophic ventricles, aortic stenosis, restrictive cardiomyopathy, constrictive pericarditis can be seen in TB. It is associated with TB in developing countries, and it can be idiopathic, or it can be due to viral illness. Developed world, in developed world it is due to viral illness, and in developing country it is due to TB, or it can be due to idiopathic also. Holocystic murmur can be due to VST, tricuspid regurgitation, mitral regurgitation, tricuspid and mitral regurgitation, VST. Ejection click can be heard, or it can be associated with aortic stenosis. Mitral valve stenosis is associated with rheumatic heart disease. Opening snap is associated with mitral stenosis. Mitral valve stenosis is associated with rheumatic heart disease, and opening snap is associated with mitral stenosis. Heart murmur, which is congenital, it is due to mitral valve prolapse. Chronic arrhythmia, it is due to aortic arterial fibrillation associated with high risk of emboli. Cyanosis early, which is less common, it is due to tetralogy of Fallot, transposition of great vessels, truncus arteriosus, total anomalous pulmonary venous return, tricuspid atresia, all TTT. Tetralogy of Fallot, transposition of great vessels, truncus atreus, total anomalous pulmonary venous return, tricuspid atresia. Late synotic shunt, uncorrected left to right becomes right to left. Late synotic shunt, uncorrected left to right becomes right to left. It is associated with Eisenmenger syndrome. It is caused by ASD, VSD, PDA, results in pulmonary hypertension or polycythemia. Congenital cardiac defect or congenital cardiac anomaly is associated with BST. So this is page number 729. So okay, now let's continue page number 729 also, as it is just 9 minutes. Now page number 729, section 3, key association rapid review. So on the left side there is disease findings, and on the right side there is most common important association. So hypertension, which is secondary, it can be associated with renal arterial stenosis, chronic kidney disease. Chronic kidney disease examples are polycystic kidney disease, diabetic nephropathy, and it can be associated, secondary hypertension can be associated with hyperaldosteronism. So three conditions like renal artery stenosis, chronic kidney disease, and hyperaldosteronism can cause secondary hypertension. Aortic aneurysm, which is on thoracic side, it can be due to Marfan syndrome. It is idiopathic cystic medial degeneration. Idiopathic cystic medial degeneration. Aortic aneurysm, which is abdominal, it can be due to atherosclerosis. Smoking is a major risk factor. Abdominal aortic aneurysm, it can be due to atherosclerosis, and aortic aneurysm, that is thoracic, it can be due to Marfan syndrome, that is idiopathic cystic medial degeneration. So aortic aneurysm, ascending or arch type, it can be due to tertiary syphilitic aortitis, vasa vasorum destruction. So aortic aneurysm, ascending or arch type, it is due to tertiary syphilis, and it is also called syphilitic aortitis, vasa vasorum destruction. So vasa vasorum destruction. So sites of atherosclerosis are abdominal aorta is common, then after that coronary artery, then popliteal artery, then carotid artery. So now aortic dissection is associated with hypertension. It is associated with hypertension. Right heart failure due to pulmonary cause, it is due to right heart failure due to pulmonary cause, it is due to cor pulmonale, we call it as a cor pulmonale. Heart valve in bacterial endocarditis, it is mitral, is more common, then aortic, then tricuspid. So heart valve in bacterial endocarditis, mitral, aortic, tricuspid. MAT, heart valve in bacterial endocarditis. So mitral is more common, which is present on left side. So mitral, aortic is present in rheumatic fever, and tricuspid, that is in IV drug users. So IV drug users. Now endocarditis presentation associated with bacterium. Endocarditis associated with bacterium. So now S aureus, that is acute or IVDA tricuspid valve, and viridans streptococci for subacute dental procedures, S bovis for colon cancer, culture negative, that is for Coxiella, Bartonella, HACEK, HEC. So temporal arteritis, so risks of ipsilateral blindness due to occlusion of ophthalmic artery or polymyalgia rheumatica. Temporal artery, risks of ipsilateral blindness due to occlusion of ophthalmic artery, or polymyalgia rheumatica. Recurrent inflammation or thrombosis of small or middle vessels in extremities, that is Buerger syndrome. Buerger syndrome. Buerger syndrome. Buerger, recurrent inflammation or thrombosis of small or medium vessels in extremities. Recurrent inflammation or thrombosis of small or medium vessels in extremities, that is due to Buerger's syndrome. B-U-E-R-G-E-R. B-U-E-R-G-E-R's Buerger syndrome. It is due to Buerger syndrome. Now, Buerger disease is strongly associated with tobacco. Cardiac primary tumor and cardiac primary tumor in kids, that is rhabdomyoma, often seen in tuberous sclerosis. Cardiac tumor in adults, it is metastatic. Myxoma 90% in left atrium, there is ball valve, we call it as a ball valve. CAH, congenital adrenal hyperplasia or hypotension, that is 21 hydroxylase deficiency. 21 hydroxylase deficiency. 21 hydroxylase deficiency. So hypopituitarism. Hypopituitarism, congenital adrenal hyperplasia or hypotension, it is due to 21 hydroxylase deficiency. 21 hydroxylase deficiency. 21 hydroxylase deficiency. Congenital adrenal hyperplasia with hypotension. 21 hydroxylase deficiency with hypotension, it is due to 21 hydroxylase deficiency. So hypopituitarism, it is due to pituitary adenoma. Hypopituitarism, it is due to pituitary adenoma. Hypopituitarism, it is due to pituitary adenoma. So it is usually benign tumor. Hypopituitarism is usually benign tumor. And thyroid cancer, it is papillary carcinoma. Thyroid cancer, papillary carcinoma. Thyroid cancer, papillary carcinoma. Thyroid cancer, papillary carcinoma. Thyroid cancer, papillary carcinoma. Hypoparathyroidism, it is accidental excision during thyroidectomy. Thyroid cancer, it is papillary carcinoma. Thyroid cancer, papillary carcinoma. Childhood irradiation. Papillary carcinoma, mostly due to irradiation. Mostly due to irradiation. So thyroid cancer is due to irradiation. Childhood irradiation. So next one, hypoparathyroidism. Hypoparathyroidism, it is due to accidental excision during thyroidectomy. Hypoparathyroidism, it is due to thyroid excision. It is due to accidental thyroid excision. Primary hyperparathyroidism. It is due to adenoma, hyperplasia, carcinoma. Secondary hyperparathyroidism, it is due to hypocalcemia of chronic kidney disease. Hypocalcemia of chronic kidney disease. So hypocalcemia of chronic kidney disease. Hypocalcemia of chronic kidney disease. Hypocalcemia of chronic kidney disease, that is secondary hyperparathyroidism. Now Cushing syndrome. So Cushing syndrome, it is due to iatrogenic from corticosteroid therapy. Cushing syndrome can be iatrogenic from corticosteroid therapy, and it can be due to adrenocortical adenoma secretes excess cortisol. Adrenocortical adenoma, adrenocortical adenoma, adrenocortical adenoma. It can be due to adrenocortical adenoma. It can be due to adrenocortical adenoma. Adrenocortical adenoma. It can be due to adrenocortical adenoma secretes excess amount of cortisol. 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 So now the other cause for Cushing syndrome is ACTH secreting pituitary adenoma. 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 Adrenocortical adenoma. ACTH secreting pituitary adenoma, that is called Cushing's disease. That is called Cushing disease. Adrenocortical secreting ACTH secreting pituitary adenoma. ACTH secreting pituitary adenoma. It is also called Cushing disease. So paraneoplastic, it is due to ACTH secreting by tumors. Paraneoplastic, it is due to ACTH secreting by tumors. Paraneoplastic, it is due to ACTH secreting by tumors. Paraneoplastic, it is due to ACTH secreting by tumors. So now primary hyperaldosteronism. Primary hyperaldosteronism, it is due to adrenal hyperplasia or adenoma. Primary hyperaldosteronism, it is due to adenoma or hyperplasia. Adenoma or hyperplasia. Tumor of the adrenal medulla in kids, it is neuroblastoma. Tumor of adrenal medulla in adult, it is pheochromocytoma. So neuroblastoma, tumor of adrenal medulla in kids, it is neuroblastoma. Tumor of adrenal medulla in kids, it is neuroblastoma, which is malignant in nature. But tumors in adrenal medulla in adults, it is pheochromocytoma, usually benign. So refractory peptic ulcer and high gastric level. Refractory peptic ulcer and high gastric levels, it is Zollinger-Ellison syndrome. Refractory peptic ulcer and high gastrin level. 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 Refractory peptic ulcer and high gastrin level, it is Zollinger-Ellison syndrome. Zollinger-Ellison syndrome. Zollinger-Ellison syndrome, it is a gastrinoma of duodenum or pancreas. Zollinger-JD syndrome. Zollinger-Ellison syndrome, it is a gastrinoma of duodenum or pancreas. It is associated with MEN1. So esophageal cancer, it is squamous cell cancer in worldwide, and adenocarcinoma in US. Acute gastric ulcer associated with CNS injury, it is Cushing ulcer. It is due to increased intracranial pressure, which stimulates vagal secretion of gastric acid, gastric H plus secretion. Increased intracranial pressure stimulates vagal gastric H plus secretion. So that is Cushing ulcer. It is a acute gastric ulcer associated with CNS injury. Acute gastric ulcer associated with severe burn, that is Curling ulcer, and it is greatly reduced plasma volume results in clogging of gastric mucosa. Greatly reduced plasma volume results in clogging of gastric mucosa. Clogging of gastric mucosa. Acute gastric ulcer associated with severe burns. Acute gastric ulcer associated with CNS injury. Cushing ulcer. Increased intracranial pressure stimulates vagal gastric acid plus secretion. Esophageal cancer, squamous cell carcinoma worldwide, endocarcinoma in US. Refractory peptic ulcer are high gastrin level, that is refractory peptic ulcer and high gastrin level, that is Zollinger-Ellison syndrome. Gastrinoma of duodenum or pancreas, it is associated with MEN1. So tumor of adrenal medulla in adults, there is pheochromocytoma, which is benign. Tumors of adrenal medulla in kids, there is neuroblastoma, which is malignant. Primary hyperaldosteronism, it is due to hyperplasia of adrenal or adenoma. Cushing syndrome, it can be due to many causes, like mainly it is iatrogenic from corticosteroid therapy, and adrenocortical adenoma secretes excess cortisol. ACTH secreting pituitary adenoma, that is Cushing disease. Paraneoplastic due to ACTH secreting by tumors. ACTH secreting pituitary adenoma, that is Cushing disease. Adenocortical adenoma, that secretes excess cortisol. So hyperparathyroidism, primary is due to adenoma, hyperplasia, carcinoma. Secondary due to hypocalcemia of chronic kidney disease. Hypocalcemia of chronic kidney disease. So hyperparathyroidism due to external excision during thyroid surgery. And thyroid cancer can be papillary carcinoma. It is mainly due to childhood irradiation. Congenital hypothyroidism, cretinism, it is due to thyroid degenesis or dysharmogenesis or iron deficiency. Congenital hypothyroidism, it is due to thyroid dysgenesis, dysharmogenesis, iron deficiency. Hypopituitarism, it is due to pituitary adenoma, usually benign tumor. Hypopituitarism, it is due to pituitary adenoma, usually benign tumor. Congenital adrenal hyperplasia with hypotension, it is due to 21 hydroxylase deficiency. Cardiac tumor, adult, it is due to metastasis, myxoma in 90%. Left atrium, myxoma, metastasis, that is called myxoma in 90% in left atrium. It is called ball valve. Cardiac primary tumor in kids, rhabdomyoma, often seen in tuberous sclerosis. Recurrent inflammation or thrombosis of small medium vessels in extremities, Buerger's syndrome, is strongly associated with tobacco. Recurrent inflammation, thrombosis of small medial vessels in extremities, Buerger syndrome. Temporal arteritis, risk of ipsilateral blindness due to occlusion of ophthalmic artery, polymyalgia rheumatica. Endocarditis, presentation associated with bacteria. S. aureus, it is acute. IVDA, tricuspid valve. And viridans streptococci, it is subacute dental procedure. S. bovis, it is due to colon cancer. Cultural negative are Coaxilla, Bartonella, HACEK, Coaxilla, Bartonella, HEC. It is cultural negative. And S. bovis is due to colon cancer, and Streptococcus viridans is due to, it is subacute or during dental procedure, and S. aureus, it is acute. IVDA, tricuspid valve, it is endocarditis presentation associated with bacterium. So heart valve in bacterial endocarditis mainly mitral, then after aortic in rheumatic fever, but in IV drug uses it is tricuspid. Mitral is more in rheumatic fever, and then after aortic, but in IV drug users it is tricuspid heart valve in bacterial endocarditis. Right heart failure due to pulmonary cause, it is corpulmonary. Right heart failure due to pulmonary cause, it is corpulmonary. Aortic dissection, it is due to hypertension. Sites of atherosclerosis: abdominal, coronary, popliteal, carotid. It is on serially, more on abdominal aorta, coronary artery, popliteal artery, carotid artery. So aortic aneurysm, there is three types: aortic aneurysm on thoracic, abdominal, and ascending arch of aorta, ascending or arch of aorta. So on thoracic, it is Marfan. It is idiopathic cystic medial degeneration. It is idiopathic cystic medial degeneration. On abdomen, aortic aneurysm, it is due to atherosclerosis. Smoking is a major risk factor. And on ascending arch or just arch, it is syphilis, which is tertiary syphilis. It is also called syphilitic aortitis, vasa vasorum destruction. There is a destruction of vasa vasorum in syphilis. So hypertension, which is due to secondary cause, it can be due to renal artery stenosis, chronic kidney disease, and hyperaldosteronism. Chronic kidney disease can be due to many causes by polycystic kidney, diabetic nephropathy. So now let's do revision of this again from the page number 728. Congenital cardiac anomaly, it is VST. Left synotic shunt, uncorrected, left to right becomes right to left. So Schminger syndrome, it is caused by EST, VST, PDA. It results in pulmonary hypertension or polycythemia. Cyanosis, early, and it is less common. It is due to tetralogy of failure, transposition of great vessels, truncus arteriosus, total animals, pulmonary venous return, tricuspid atresia. Tautology of failure, transposition of great vessels, tetralogy of failure, transposition of great vessels, truncus arteriosus, total anomalous pulmonary venous return, tricuspid atresia. Chronic arrhythmia, it is due to atrial fibrillation associated with high risks of emboli. Heart murmur, which is congenital, it is due to mitral valve prolapse. Opening snap, it is due to mitral stenosis. Opening snap, mitral valve stenosis is due to rheumatic heart disease. Mitral valve stenosis, rheumatic heart disease. Ejection click, aortic stenosis. Ejection and opening. In opening snap, it is mitral stenosis, and ejection click, it is aortic stenosis. Holocystic murmur, VST, tricuspid regurgitation, mitral regurgitation, all on the regurgitation and VST, holocystic murmur. Constrictive pericarditis, in developing country it is due to TB, in developed country it is due to viral illness, and it can be also due to idiopathic. As for ultrasound, stiff or hypertrophic ventricles, aortic stenosis or restrictive cardiomyopathy or aortic stenosis. S3 ultrasound, it is increased ventricular filling pressure. S3 ultrasound, increased ventricular filling pressure. Mitral regurgitation, HF, and common in dilated ventricles. Metastasis to liver, more in colon, stomach, pancreas. Metastasis to liver, colon, stomach, pancreas. Metastasis to brain, lungs, breast. Melanoma, colon, kidney. Metastasis to bone, prostate, breast, kidney, thyroid, lungs. Pelvic inflammatory disease due to chlamydia trachomatis, or it can be also due to Neisseria gonorrhoeae. Nosocomial pneumonia, it is due to S. aureus, Pseudomonas klebsiella, Acinetobacter. STD, it is due to chlamydia trachomatis, usually co-infection with Neisseria gonorrhoeae. UTI, E. coli, Staphylococcus saprophyticus in young women. Osteomyelitis in with IV drug users, S. aureus, Pseudomonas candida. For IV drug users, osteomyelitis, S. aureus, Pseudomonas candida. Osteomyelitis in sickle cell disease, Salmonella. Osteomyelitis S. aureus. Food poisoning endotoxin mediated S. aureus, B. serious. Infection secondary to blood transfusion. Is hepatitis C. Viral encephalitis affecting temporal lobe. it is herpes simplex virus 1. Helminth's infection in US, it is Enterobius vermicularis. Enterobius vermicularis. Helminth infection in US, Enterobius vermicularis. Opportunistic respiratory infection in AIDS, pneumocystitis, zero basis pneumonia. Pneumocystitis, zero basis pneumonia. Bacteria associated with gastritis, peptic ulcer disease, and gastric malignancy, adenocarcinoma, maltoma. Bacteria associated with gastritis, peptic ulcer disease, and gastric malignancy, adenocarcinoma, maltoma. It is due to H. pylori. HLA-DR4, diabetic mellitus type 1, rheumatoid arthritis, Addison disease. HLA-DR3, diabetes mellitus type 1, SLE Graves' disease, Hashimoto thyroiditis. It is also due to HLA-DR5 and Addison disease. Okay, so this is the complete 2 page from the rapid review, section 3, key association. I just completed page number 728 and 729, and just few points still remaining from 727. Let us complete, and then I will be completing around 3 pages of key association. So bacterial meningitis in newborn and kids, it is due to group B Streptococcus, E. coli, Listeria monocytogenes in newborns. In more than 6 months, it is due to S. pneumonia. Lysosomal storage disease is due to Gaucher's disease. Vitamin deficiency in US, folate. Vitamin deficiency, it is due to folate, and it is high risk in pregnant women. And body stores only 3 to 4 months supply. Prevents neural tube defect. Intellectual disability, it is due to Down syndrome and Fragile X syndrome. Mitochondrial inheritance disease. Sorry for that. Mitochondrial inheritance disease occurs in both males and females. Mitochondrial inheritance disease occurs in both males and females. Inherited through females only. Inherited through females only. So this is the key association. 7 points, and there are more than, I think, 15 to 20 points. Here is the same condition. So I'll be starting from 730, section 3, rapid review, key association, in the next video, so that the videos for these 3 pages won't be longer if I started reading 730. So thank you for watching till now. Please like, subscribe, and comment down if you have any suggestion during this video watching time. Keep studying for your reassembly, first step 1 or step 2, and if you are preparing for any exams, then all the best. Thank you. Keep studying.